KPBS health reporter Kenny Goldberg joins us with further insight into Proposition 46. And Kenny, briefly recap for us the three provisions to this measure.
Well, Prop 46 would raise the cap on pain and suffering damages from $250,000 to $1.1 million and would index it to inflation. It would also require doctors to have random drug and alcohol tests. And lastly, it would require doctors who prescribe narcotics to their patients to use the Cures database, which is a statewide database that can tell if a patient is doctor shopping for dangerous drugs.
Now, one of the most controversial provisions is, of course, this cap, raising this cap up to 1.1 million. The doctor you interviewed in your story said that that would increase medical insurance cost. Have you found anything out about as far as evidence that it really would raise this?
Well, I spoke to a couple of different health economists, one at Harvard and one at UCLA, and they both told me there's no evidence that there's any relationship between the cap on pain and suffering damages and malpractice insurance rates. There's also no evidence to show that any kind of cap on malpractice insurance rates or the actual price of malpractice insurance has any bearing on overall healthcare costs. So the claims of people against Prop 46, they evidently don't bear out.
Yes, and so as you said, the overall medical costs, that there's no evidence so far that actually expands out. But you also interviewed Bill Mitchell in your story, and he said he couldn't find an attorney who would take his medical case and take that to court. Is that typical? Is it difficult to get a medical malpractice case covered by an attorney?
It is, because their fee is based primarily on a percentage of that pain and suffering damage award. And when it's capped at $250,000, supporters of Prop 46 say it's tough for people to find an attorney who's willing to represent somebody in a medical malpractice case.
And just touching on that cap one more time, how do other states handle it?
Well, some have the same kind of caps, some have higher caps, and the cap on medical malpractice pain and suffering damages have been ruled unconstitutional in 6 states, most recently in Florida.
So the different states handle it differently, but still at the $250,000 here in California. Now, another provision of Prop 46 would require doctors, as you said, to use this Cure statewide database before prescribing prescription drugs or
prescription narcotics.
Narcotics, right, to patients. So basically, what are the doctors or opponents saying why they're against that?
Well, the Cures database isn't fully operational. It was almost totally defunded about 1.5 years ago, and then the legislature jumped in and appropriated some more money for it. The Cures database is being upgraded as we speak, and even advocates of using the Cures database admit it won't be fully operational till at least late 2015. So it can't handle the current number of requests, and opponents are saying there's no reason it would be able to handle even an increased number of requests.
If this measure passes, California would become the first state to require doctors to have random drug testing. What is the California Medical Association's take on that provision?
Well, the doctors I've talked to, they don't really address it per se, because they say it's just a smokescreen. And it's a smokescreen, they say, to cover up this desire to heighten the pain and suffering cap, which is written by trial attorneys. So they say it's sort of an insidious smokescreen to try to divert people's attention away from the real goal of supporters, which is to change that cap.
And how about in the San Diego medical community? I know you've spoken to quite a few doctors on this. What is their take overall on Proposition 46?
Well, they're totally against it, and they fear that it will raise malpractice insurance rates and therefore put doctors under the gun financially.
All right, KPBS health reporter Kenny Goldberg, thanks so much for the update on this. And I want to let folks know that you can see more of our election coverage on this and other measure items at kpbs.org/election.